Joining me on the program now from the Salvation Army Social Policy Unit, Ana Ika. Kia ora, good morning. Thanks for your time.
Morning, Andrew. Thanks for having me.
This is getting good health results for the population. This is a priority of any government. But with the new government, different ways of doing things and a new model of funding GP services in particular called the capitation model. Now, I confess I hadn't heard the term before. What does it mean, essentially?
Yeah, it's not necessarily new. It's sort of how primary health or general practices are funded under the government. And so the way that it's calculated is that each GP practice per patient is funded for 4 appointments per year, and those 4 appointments are 15 minutes.
Yep.
And those, so the estimation is that a patient would go to their GP 4 times a year and have a 15-minute session. But the reality is those 15 minutes in general is not long enough for GPs to be able to get into the crux of what the issues is with patients.
Yeah.
And then I guess for us at the Salvation Army, we have the Hawara, our GP clinic in Real Oak that's just, it's fairly new. That the complexities of individuals that we're supporting, their 15 minutes doesn't, you don't even you're not even able to build rapport or get in to sort of get some of the patients to address what I guess the deeper issues of or the causes of why they're coming to us. So that's how the capitation models and GPs work, is that you get 15 minutes 4 times a year across 1 year, and that's the funding that goes to those clinics. But the reality is that that's not how it works in the front line. You need more than 15 minutes
Exactly.
when you're dealing with, I guess, really complex health needs that we're seeing in the community.
A couple of things there. Firstly, I had no idea that Salvation Army was involved with health issues, in terms of, fantastic work the Salvation Army does. Is this a relatively new thing for you guys to be involved directly in providing healthcare?
Yeah, absolutely. I think majority of GPs are sort of 69% of GPs in New Zealand are owned by GPs, and so they're sort of run on a for-profit model.
Yep.
Only 7% of GPs around the country are run by communities, trusts, or charities. And then on the other end of that, those 7% of the not-for-profit charity sort of run general practices, they're not run, a lot of them don't sort of have the resources or the experiences in working with complex tangata whaiora. So
Yep.
those who come through our bridge or addiction services, we call them tangata whaiora, which basically means a person trying to better their health.
hmm
And so there's a huge gap in regards to primary health care for tangata whaiora. And so that's one of the significant reasons why the Salvation Army have moved into that health space to try and fill that gap and that need there that we're seeing in regards to complex families, complex needs, complex mental health challenges,
Yeah.
and complex addiction issues that they all sort of mesh together. And so I think the average time, the last time I checked with our Hawara clinic, for them to see one of their patients is about 45 minutes to an hour.
Yeah.
So just in that one session, Andrew, they've taken up all their funding, trying to address and get to the crux of why this patient has come in and what it is we can do to be able to better support them.
There's quite a few things there, and honestly, a lot of pressure on GPs at the moment, trying to find any type of funding model that works. And you say a lot of GP practices owned by the GPs themselves, but a lot of those are going out of business and needing to change their models. What would you recommend here, rather than have the situation where every GP practice needs to be run by a charity because none of them are breaking even? What type of model would be more equitable, particularly for the types of communities that you guys are serving?
Yeah, I think health is a beast in itself. I mean, that's a fairly new area for our unit to be advocating for, but because that's a sort of one of the key services that we're now providing in Auckland to try and plug that gap. The issue of primary healthcare is that I think there only about 5% of the health funding goes to primary healthcare. But the reality is, Andrew, if people had received primary health
Yeah.
um, you could prevent up to 30 to 40 ED admissions or ED presentations to the hospitals, which saves significant costs. And then I think it's about 20% of hospital admissions could have been prevented on health issues that would have been dealt with in primary healthcare. And so there's so there's a lot of challenges and issues in secondary health in the hospitals that could have been prevented had the primary healthcare service been properly funded and given the adequate support.
Because part of the problem there, of course, is people can't afford to go to their local doctor, even if it is subsidised. So they rock up at the emergency departments for something which they should be going for a doctor to, because they honestly don't have the money to pay the bills.
Yeah, absolutely. I think that's one of the biggest issues, and with our whole order clinic, I think it's for those that are coming from our community ministries or coming from our transitional housing, it's about having that discussion with them. Like, it's only $19.50 for an enrolled patient, which is significantly cheaper than many other GPs. Yep. Is this affordable? Can you afford this? If not, what are the alternatives or options there? Because ultimately, being able to support our families and that end could prevent significant financial issues in the long term when we're looking at secondary healthcare. And so, yeah, the cost is a huge burden to a lot of the families we support. And so that's why they would just leave it till it gets worse and leave it until they have to be presented, they present in the ED. And so more work needs to be done around making sure that GP services are affordable to those who are struggling and are in need.
And honestly, some people just need more healthcare than others. Some people with, as you say, with struggling with addiction, or perhaps have a lifestyle illness or a genetically inherited condition, they're going to need to see the doctor for longer periods of time than somebody who is healthy and pops in once a year for a checkup, perhaps.
Yeah, absolutely. And I think that's sort of one of the things that we're looking at Hullwater, because if like myself or you, Andrew, if we don't show up to the doctor, that GP clinic still gets that funding for those four estimated visits to the GP, and so that funding still goes towards the GP practice in general. So for those who are sort of in GP practices, even though it's really difficult to get into a GP practice, but if you sign up and if you go in to a GP practice that supports the community or has initiatives that target particular areas of the community, and that you generally don't need to go to the GP as often, which is majority of New Zealanders, and then that funding that is attributed towards you will go towards that GP clinic in order for them to be able to address others.
And the crazy thing about that, honestly, is that the only GPs that are breaking even are those that are living in a part of New Zealand where people don't turn up to the doctor that often. And they're still getting paid for those appointments that never happen, perhaps. And also, I imagine clinics such as the one that you guys are operating in Royal Oak, because it's lower fees, there's going to be more demand on that service than there is for some of the other GP clinics in that neighbourhood.
Yeah, absolutely. We're still trying to, raise awareness of the Holder Clinic, not only within our services but in the community as well. Just to allow, just to try and remove some of those barriers that a lot of our families are facing in regards to accessing GP care. And so, so that there's a lot of work in that space to try and engage those in our communities in the sort of whole water service that we're providing.
Hey, as you say, the health sector is a bit of a beast. Difficult one for any type of policy or program to get around. But thank you for the work that you're doing, both in terms of advocacy, in terms of drawing this to the attention of policymakers, but also boots on the ground in communities providing such healthcare. Ana, thank you so much for joining us once again.
Thanks, Andrew.
Hey, thanks very much for joining us in the Rhema studio. Thanks very much for watching the interview. It's kind of nice to have an audience, actually. And if you did like what you watched, then do give us a like, do give us the thumbs up. And if you'd like to see more interviews like that one, or perhaps even better, subscribe and those interviews will come straight to you. Don't forget to turn on your notifications, and we'll see you in the next one. Cheers.